Hi, welcome to week 12. We're going to have a busy week this week, so I want to make sure that you understand your assignment. So let's get to it. So let's look at the week 12 checklist. In week 12, we're going to actually read two chapters in Lewis, and it's chapter 61, Acute Intracranial Problems, and Spinal Cord and Peripheral Nerve Problems. And then the assignments that are due for a grade before Sunday at 11:59 p.m. are in SurePath, the following three lessons: uh, inflammatory conditions of the brain tumors and cranial surgery, head injury, and intracranial regulation. That's in Module 1. And then in Module 2, we will complete two lessons: nursing management, spinal cord injury and spinal cord tumors, and spinal cord problems. And then you will complete the ATI Content Mastery Series, Fundamentals Practice B exam, and then complete the discussion post after watching the Selma Blair video. I would like to give you some encouragement this week. We are getting closer to your goal of completing Adult Nursing 2. I know that has to be feeling good, or it's starting to feel good. After having spoken to many of you through email and in person, I hear underlying themes of, can I do this? Am I going to make it through this semester? I'm having trouble juggling all of my priorities. It is in times like this that we need to remember to offer up our worries to God in prayer, hand them over to Him, and trust Him to take care of those things. Do this as many times as needed to surrender your will to God so that you can experience peace and be able to stay in the present and not worry about the what ifs in life. I would like to share the following verse with you to hopefully help with anxiety. It's Psalm 56, verse 3 and 4. Whenever I am afraid, I put my trust in you, in God, whose word I praise. In God I trust and am not afraid. And I will post this video link there. So let's get into Module 1. In addition to Lewis chapter 61, you're also going to read about brain disorders in ATI chapters 5, 9, and 14. And then there's also a video you're going to watch. So let's open up Module 1. I have posted a PowerPoint here that goes over the big ideas of the module. Then here is your assigned reading. Your key points, as always, you have your vocabulary. And then there is some tables for you to review. You need to know what Cushing's triad is, look at nursing assessment, signs and symptoms of increased intracranial pressure, a Glasgow coma scale, know how to calculate, normal score, coma score, and that is table 61.5. Review positioning for patients with increased intracranial pressure, um, review head injuries, clinical manifestations, and the nursing assessment. That's in table 6110. Acute interventions, patient and caregiver teaching, table 6111. Look at clinical manifestations of concussion, and then cerebral spinal fluid leakage of otorrhea and rhinorrhea. Brain tumors, ATI chapter 9. Uh, Look at know the general functions of the lobes of the cerebrium and the cerebellum, and look at cranial surgery, nursing interventions, and then last but not least, meningitis, which is ATI chapter 5, and it's also table 6117 in your Lewis, and look at your clinical manifestations of meningitis and acute nursing interventions. Then we're going to expand our understanding by reviewing this video that's 31 minutes on increased intracranial pressure. And then, as I mentioned before, we're going to practice our knowledge in SurePath. And we actually have four assignments there that are graded in SurePath this week for Module 1. Then going back in to Module 12, go ahead. We are going to open up Module 2. Again, I have posted a PowerPoint with the big ideas of the module. We're going to be reading Lewis chapter 5, 65 and ATI chapter 16. and it's about spinal cord injuries. As always, we're going to check our understanding with the 5 application exercises at the end of the chapter, and then read Lewis chapter 65, spinal cord and peripheral nerve problems. Here is our vocabulary. We're going to learn about identifying disabilities based on the level of injury, and that is figure 65.3 and table 65.2. Identify what level of injury results in paraplegia instead of tetraplegia, or it's now known as, or it formerly was known as quadriplegia. Our nursing assessment, table 65.5, and then our nursing implementation for pain management, reflexes, how to manage autonomic dysreflexia. That's page 1606, table 65.7. Rehabilitation and home care, respiratory rehabilitation, neurogenic bladder interventions, grief response for spinal cord injury, prioritizing care, and then teaching guides. And there's several tables for teaching guides. Then we are going to expand our understanding by reviewing this video on nerve transmission animation, and then this video on introduction to spinal cord injury. It's very short. And then here is a good explanation with pictures of levels of spinal cord injury. And then we have 2 graded SurePath lessons and 1 optional SurePath lesson for Module 2 this week. Then going back into our home page for week 12, you want to complete the ATI Content Mastery Series, Practice Assessment B. And just remember, this practice assessment, you do not use any resources. The goal is to measure your own knowledge or your current knowledge. It does not require proctoring. So this is a low pressure opportunity to self-evaluate your current knowledge. It will be open Monday, October 3rd, 23rd, and closed Sunday, October 29th. And here are the directions on how to open the ATI Practice Assessment B. And if you're having trouble, here are the directions for that. And then here is the memo on how to access it as well. So please review this memo. And then you are going, you are going to do a focused review. And these templates are due by next Sunday night. That would be the Sunday of week 13 at 11:59. Please follow these directions completely. So you're going to receive a report showing your score and topics that you need for your personal improvement. You are assigned to spend a minimum of an hour in focused review on the topics mentioned in your report. Most students are going to spend much more than an hour. There is a timer to keep track of your time at the top of the page. While reviewing, you are assigned to fill out templates. The idea is that both reading and writing help with knowledge of retention. Using your ATI score report, fill out the templates on topics that you missed on the practice exam, a minimum of 10 and a maximum of 20 templates. Sometimes completing the templates is a type of remediation because you've forgotten concepts that you've learned. Other times, it's going to introduce topics you will learn about later in the course. Research shows that both early exposure to topics and reviewing is going to help you in the long run. So invest your heart and mind during this study time to become an outstanding nurse. People need your expertise. So if you have more questions about getting started with doing focused reviews, please review this document because you'll find it very helpful. And then if you have more questions, you can actually review a video that is inside ATI. And then remediation is due, like I said, Sunday of week 13. So you do not have to do it in this week. You do your test this week. You will have another week to do your templates. But I would start working on the templates as soon as you can because they are very difficult to complete in a short amount of time. And Templates vary in style depending on the topic you are being requested to review, and be sure to grab the template that matches the topic. I don't think everybody followed these instructions to the letter the last time we did templates, so please follow it this time. And so and when you go to turn them in, take screenshots, photo scans of both pages of your report. The first page shows your assessment score and time spent in review. The second page reports the appropriate number of templates you should have completed and to which content areas the template should relate. Before you upload it, please adjust the name of your document image in your device to indicate which uploaded documents are your report results. For example, you might name your file ATI Test B Results Page 1 or Report Page 2, and then upload both pages of your report and all 10 to 20 templates, depending on what you made. Reminder, completion of all of these tasks is 2 points of your overall theory grade for the semester, so please check your work. I'm not going to be able to let you have extra time to turn in your templates because we are nearing the end of this course and we've got to just keep moving through. So it all has to be done timely from here on out. I won't be taking late assignments. So I just wanted to forewarn you about that. So then going back into week 12, we are going to review the video from week 11 on neurological assessment first. And then we're going to watch this video about MS. And then we are going to watch a video about Selma Blair. She's an actress who has MS. And you're going to use your assessment skills to identify 5 abnormal findings in the Selma Blair video. And then after, you will click on the link to the discussion forum, which is the title of this item, Week 12 Neurologic Assessment. That is actually, you're going to click on that link right there, and it will open up another box, and you will create a thread in the forum to complete the assignment. You will add your 5 abnormal findings as a post in the discussion forum, along with 3 to 5 nursing intervention or patient education topics and why you chose those interventions for patients with multiple sclerosis by Friday at 5 p.m. You will then review and reply to another student's post stating if you agree or disagree with their interventions or education topics and why by Sunday at 23:59 p.m. An example of this, is it something you hadn't thought of, or could it be enhanced in some way to improve the quality of life for the patient? I need your discussion post to pull back what you got out of reading that person's post. So, and then you will do your NCLEX review. There are 22 quick NCLEX practice questions here on increased intracranial pressure. It is not scored, but highly encouraged for you to review this because you're practicing for your NCLEX. And then we will have a live class session Thursday night at 7. So that is it for week 12, and hope to talk to you or see you soon.